All right, let's talk about Medicare. If you've ever looked at all the different parts, A, B, C, D, and felt like you were trying to solve some kind of alphabet soup puzzle, you're definitely not alone. It can feel really confusing. But don't worry, we're going to break it all down piece by piece, and I promise it's going to make a whole lot more sense.
So, here's the game plan. We're going to start with the absolute foundation, Parts A and B. Then we'll see how you can add prescription drug coverage with Part D. After that, we'll look at a totally different all-in-one option called Medicare Advantage. We'll also touch on Medigap, which helps cover costs. And finally, we'll pull it all together so you can see the two main paths you can choose from.
Okay, first things first. Let's talk about the foundation of the entire system, what's known as Original Medicare. You can think of Parts A and B as the fundamental building blocks. This is the coverage that pretty much everyone gets when they enroll. Let's dig into what each one actually does. So, Part A is really your hospital insurance. Simple as that. If you're admitted into a hospital, or maybe you need care in a skilled nursing facility for a little while after a hospital stay, Part A is what kicks in to help cover those really big bills. And here's the best part. For most people who've paid Medicare taxes over the years, Part A is premium-free.
Now, if Part A is for the hospital, Part B is your medical insurance. This covers pretty much everything else. We're talking about your regular doctor's appointments, outpatient care, medical equipment like a walker or wheelchair, and even a lot of preventive stuff like flu shots and wellness visits. This is for your day-to-day medical needs.
Okay, so this is where Part B is a little different from the often premium-free Part A. You do have to pay for Part B, and the costs usually come in three main flavors: a monthly premium, an annual deductible, and then something called coinsurance. Let's look at each one.
First up is that monthly premium. For 2026, the standard amount is projected to be around $202.90. This is the fee you pay every single month just to keep your Part B coverage active. For a lot of folks, it just comes right out of their Social Security check. But, and this is important, that's just the standard amount.
Next up, you've got the annual deductible. For 2026, we're looking at about $283. So what does that mean? It just means you have to pay that amount out of pocket for your medical services each year before Medicare starts chipping in. Once you've hit that deductible, that's when your coinsurance starts.
Remember how I said that premium was just the standard amount? Well, here's why. Medicare actually looks at your tax return from 2 years ago. So, based on what you earned back in 2024, your Part B premium in 2026 could be higher. You can see here, the more you made, the higher that monthly premium is going to be.
So you've got your hospital and medical insurance. You're all set, right? Well, not exactly. It's really important to know what Original Medicare doesn't cover. And there are some pretty big gaps here, like most prescription drugs you take at home, and pretty much all routine dental, vision, and hearing care. So now we've got to figure out how to fill those gaps.
Okay, let's tackle that first major gap we just saw, prescription drugs. This is where the next letter in our alphabet soup, Part D, comes into play.
Now, the interesting thing about Part D is that it isn't run directly by the government. Instead, you buy a Part D plan from a private insurance company that's been given the thumbs up by Medicare. So you add this plan onto your Original Medicare to help you pay for your prescriptions at the pharmacy.
Okay, I need you to pay close attention to this because it is so important. Timing is everything with Part D. Even if you don't take any pills right now, you have to know this rule. If you wait too long to sign up for a drug plan and you don't have other good coverage, you could get hit with a penalty that gets tacked onto your premium for the rest of your life. Seriously.
So far, we've been talking about taking Original Medicare and adding pieces to it, but there's a completely different way to go. Let's look at the all-in-one option. You might hear it called Part C, but most people just call it Medicare Advantage.
So instead of getting your coverage directly from the government, you can choose one of these Medicare Advantage plans from a private insurance company. Now, these plans legally have to cover everything that Original Medicare covers, but they usually bundle in your prescription drug coverage too. It's all in one package.
And here's one of the main reasons people go down this path. Remember those gaps we talked about with Original Medicare? Well, these Advantage plans often include benefits for some of those things, like routine dental cleanings, eye exams, and hearing aids. Some even include fitness programs and gym memberships. These are all extras you just don't get with Parts A and B alone.
Okay, let's hit pause for a second and rewind. What if you like the freedom of Original Medicare, but you're worried about those out-of-pocket costs, like the 20% coinsurance? Well, there's another piece you can add to the puzzle, and it's called Medigap.
A Medigap policy is also sold by private companies, but it's not health insurance in the same way.
Its whole job is to work with your original Medicare. So after Medicare pays its share of a bill, your Medigap policy can step in and help pay for some or even all of the leftover costs, like your deductibles and that 20%.
This is probably the #1 point of confusion for people. You've got Medigap and you've got Medicare Advantage. They're both from private companies, so what's the difference? They actually work in completely different ways. So let's put them side by side to make it really clear.
Okay, this chart makes it super simple. Medigap supplements original Medicare, it works with it. Medicare Advantage is an alternative to original Medicare. It works instead of it. And here's the absolute rule. You cannot have both at the same time. One helps pay the bills for original Medicare, the other one is your Medicare. That's the key.
So when you boil it all down, it really comes down to two very different paths you can take. A good way to think about it is like you're at a restaurant. You can either order a la carte, picking and choosing each piece, or you can just get the combo meal.
And here's the choice laid out. Path 1 is that a la carte original Medicare path. You get parts A and B, and then you build your coverage by adding a drug plan and maybe a Medigap policy. The biggest plus here? Freedom. You can go to any doctor or hospital in the country that takes Medicare. Path 2 is the combo meal, Medicare Advantage. It's a bundled plan which is often simpler, but you usually have to stick to doctors and hospitals that are in that plan's network.
And this breakdown from the official Medicare guide really drives home those differences. Look at original Medicare on the left. It covers most necessary services, but you'll need a separate drug plan. A huge point is that you usually don't need to get approval beforehand. Now look at Medicare Advantage on the right. It covers all the same stuff, but it often bundles in those extras. The trade-off? You can see right there. In many cases, you might need to get approval from the plan before it will cover a service.
So what's the bottom line here? What's the biggest takeaway from all this? It's that you have a choice. There is no single best way that works for every single person. Just understanding these basic building blocks and the two main paths they create is the most important first step you can take to make a smart decision for yourself.
And that all leads to the final and really the most important question of all. It's not about which path is better in general, it's about which path is better for you. Do you value having the freedom to see any doctor you want? Or are extra benefits like dental and vision a top priority? Is a simpler all-in-one plan more your style? Now you have the framework to start thinking about what really matters for your health and your lifestyle.